Welcome. I am Dr. Thomas Gerber, one of the Associate Editors of Mayo Clinic Proceedings. In this recording, I would like to review for you the articles that our Editor-in-Chief, Dr. William Lanier, has chosen to be featured on the cover of the November 2012 print journal, along with the accompanying editorials. One cluster of articles in this month's issue of Mayo Clinic Proceedings focuses on Clostridium difficile infections. The original article, entitled Clostridium difficile infection in patients with chronic kidney disease, was authored by Dr. Smira Kedis and colleagues from Mayo Clinic in Rochester, Minnesota. The authors used data for 2005 to 2009 from the National Hospital Discharge Survey to examine the rate of Clostridium difficile infections and hospital-associated outcomes. Among an estimated 162 million adult hospitalizations, 5% had chronic kidney disease. Compared to patients with normal kidney function, patients with chronic kidney disease had longer hospitalization, higher colectomy rate, higher likelihood of dismissal to a care facility, and increased in-hospital mortality. The review article, entitled Clostridium difficile infection, New Insights into Management, was authored by Dr. Sahil Khanna and Darrell Pardee from Mayo Clinic in Rochester, Minnesota. The authors discuss novel risk factors and newer treatment methods for Clostridium difficile infections, such as fidaxomicin therapy, treatment using monoclonal antibodies, and fecal microbiota transplantation. The accompanying editorial, entitled Clostridium difficile, the Emerging Epidemic, was authored by Dr. Nasia Safdar from the University of Wisconsin in Madison, Wisconsin. A second cluster of articles in this month's edition of Mayo Clinic Proceedings focuses on end-of-life decisions and the application of palliative medicine. The special article, entitled End-of-Life Care Decisions, Importance of Reviewing Systems and Limitations After Two Recent North American Cases, was authored by Drs. Christopher Burkle and Jeffrey Benson from Mayo Clinic in Rochester, Minnesota. Based on two recent North American cases involving end-of-life treatment, the authors examine the present systems in the United States and Canada for resolving end-of-life decisions, including the difficulties defining medical futility, the role of medical ethics committees, and controversies regarding surrogate decision-making. The concise review for clinicians, entitled Clinical Pearls in Palliative Medicine 2012, was authored by Dr. Keith Swets and colleagues from Mayo Clinic in Rochester, Minnesota. The authors present 6 short cases of patients in need of palliative care that each are followed by a multiple-choice question and in-depth discussion that ends with a concise clinical pearl. Issues addressed in the current article include treatment of pain in patients with cognitive impairment, opioids for the treatment of dyspnea refractory to other medical management, withholding or withdrawing life-sustaining treatments that are not consistent with a patient's goal of care, and the treatment for emesis in patients with end-stage cancer. The accompanying editorial, Little Hope for Medical Futility, was authored by Dr. Arthur Kaplan from Langone Medical Center in New York, New York. In this thought-provoking piece, Dr. Kaplan discusses why, in his opinion, the future of futility assessment, as well as downstream actions based on those assessments, look bleak in light of the fact that American society is increasingly committed to respecting patient autonomy and family wishes at the end of life. The article, Pericardiectomy versus Medical Management in Patients with Relapsing Pericarditis, was authored by Dr. Masood Kandakar and colleagues from Mayo Clinic in Rochester, Minnesota. The authors retrospectively reviewed the medical records of 184 patients with persistent relapsing pericarditis, of whom 58 underwent pericardiectomy after failed medical management. Over more than 5 years of follow-up, the authors found that in patients with chronic relapsing pericarditis in whom medical management has failed, surgical pericardiectomy is a safe and effective method of relieving symptoms. The original article entitled Rate and Predictors of Serious Neurologic Causes of Dizziness in the Emergency Department was authored by Dr. Babak Navi and colleagues from Weill Cornell Medical College in New York, New York, and several other national healthcare institutions. The authors retrospectively reviewed the medical records of 907 consecutive patients who presented to an academic emergency department for a primary symptom of dizziness, vertigo, or imbalance. They found that dizziness in the emergency department is generally benign, although a substantial fraction of patients had serious neurologic disease. Clinical suspicion should be high in patients with advanced age, imbalance, or focal neurologic deficits. The original article entitled Incidence of Monoclonal Gammopathy of Undetermined Significance and Estimation of Duration Before First Clinical Recognition was authored by Dr. Terry Thurneau and colleagues from Mayo Clinic in Rochester, Minnesota. The authors used prevalence data from Olmsted County, Minnesota, to estimate the incidence of monoclonal gammopathy of unknown significance, also known as MGUS, along with follow-up from a large cohort of patients with clinically detected MGUS. They found that the age-related increase in prevalence of MGUS is related to a true increase in incidence with age. When MGUS is first clinically recognized, it has likely been present but remained undetected for a median duration of more than 10 years. The commentary entitled Considerations on Safety Concerns about Citalopram Prescribing was authored by Dr. Robert Sheeler and colleagues from the Rochester, Jacksonville, and Scottsdale campuses of Mayo Clinic. Going from the recent U.S. Food and Drug Administration's recommendation not to use doses higher than 40 milligrams per day because of potential QT prolongation and the risk of serious cardiac arrhythmia, the authors aim to provide information that meets the needs of both primary and tertiary care populations of patients, as well as those of prescribers with varying degrees of knowledge. Authors or co-authors of 6 of the articles we have discussed have provided video interviews. These interviews are available on the homepage of Mayo Clinic Proceedings at www.mayoclinicproceedings.org in the upper right-hand corner. Also on the website, our series entitled Meet the Mayo Clinic Proceedings Editorial Board and Staff this month features Dr. Ayalu Teferi from Mayo Clinic in Rochester, Minnesota, who has been an associate editor of Mayo Clinic Proceedings for many years and who is, among many other things, responsible for our Medical Images feature. As you know, you will also find on our homepage additional content that is not available in the print journal, such as extra residence clinics articles, medical images, stamp vignettes, and other materials. Dr. William Lanier, Editor-in-Chief of Mayo Clinic Proceedings, the entire editorial board, and I sincerely hope that you will enjoy these and the other outstanding articles in the November 2012 issue of our journal. We do thank you for your interest in and continued loyalty to Mayo Clinic Proceedings, and we are grateful for your ongoing support of our journal's mission to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. As a preview, the December issue of Mayo Clinic Proceedings will contain articles on association of resident fatigue and distress with occupational blood and body fluid exposures and motor vehicle accidents, prevalence, incidence, and classification of chronic fatigue syndrome in Olmsted County, Minnesota, and postural tachycardia syndrome, a heterogeneous and multifactorial disorder. Our December 2012 issue will go live on our website on December 6, 2012, St. Nicholas Day.
We hope you benefited from this presentation. based on the content of Mayo Clinic Proceedings. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you're interested in more information about Mayo Clinic Proceedings, visit our website at www.mayoclinicproceedings.org. There you will find additional videos on our YouTube channel, and you can follow us on Twitter. For more information on healthcare at Mayo Clinic, please visit www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.